Dr. Shannon Clark here. I am a double board certified OBGYN and maternal fetal medicine specialist. And we're going to chat about this. Trump administration ends emergency abortion requirement for hospitals. After the Dobbs decision in June 2022, there became a quick issue with whether or not abortion bans and restrictions in states in this country superseded EMTALA. So in July 2022, the Biden administration issued guidance that said, even in states with abortion bans and restrictions, EMTALA takes precedence. And this was important because emergency rooms see a lot of patients in that first trimester who are having complications. But on June 3rd, the Department of Health and Human Services and the Center for Medicaid and Medicare Services rescinded that guidance. So what's going to happen now? Right now, we have 12 states with abortion bans, and 6 states have gestational age limits between 6 weeks, 0 days, and 12 weeks, 6 days. So what used to be a pretty straightforward decision when it comes to complications of pregnancy is now going to be muddled with, am I going to lose my license and my job or go to jail if I do what needs to be done? So what might happen instead is if the patient comes in and their vital signs are stable, they're otherwise okay, then a temporizing measure may be used rather than the definitive treatment. And if y'all think that's not already happening, it is. Kylie Thurman was sent home from a Texas ER with a ruptured ectopic pregnancy. Melissa Farmer experienced pregnancy complications at 18 weeks in Missouri, went to a Kansas ER, and was sent home, where she subsequently had more complications. Nevaeh Crane was experiencing pregnancy complications, went to 2 Texas ERs in 12 hours, was sent home, went back a 3rd time, and ended up dying. Portia Gumezi sat in a Texas ER for 6 hours bleeding because she needed an emergent DNC, which is an abortion procedure. But the next doc that came on wanted to give her misoprostol pills instead, which it was too late for that. And she hemorrhaged and died. And this is a prime example of how abortion procedures have been weaponized in states with abortion bans and restrictions. Now, before y'all come into my comments and say, well, the doctor took an oath, y'all, put yourselves in the doc's shoes. Do you think you're going to do the abortion procedure and risk losing your license, your livelihood, the ability to feed your family, and potentially go to jail if someone decides you didn't do the right thing according to the law? Or if they can find a way to give antibiotics, give a blood transfusion, send them home and tell them to follow up, which door do you think that doc should choose? What would you choose?